But it is a great honor for me to join this important conversation, both as a physician and a brain doctor. I know there is one neurologist in the room here. Any other neurologists? Can you raise your? Okay, excellent. So we have a few of my own tribe. And in my day job, as Pavel mentioned, I'm a neurologist and a clinician scientist at Massachusetts General Hospital in Boston. And I'm professor of neurology at Harvard Medical School. But I wanted to let you know how important it is that we are here today as neurologists, because everything you've been talking about this morning, everything about brain economy, brain capital, brain health, everything comes to the ground zero where neurologists are. And those ground zero locations are patient rooms, where we look into the faces of our patients when we give them diagnosis, when we look at the family members who are asking important questions. And that's where actual brain health starts, and that's where it ends when we work with our patients to optimize it across the lifespan. So it's very important, and I'm very grateful for the invitation to be here, to have everyone in this room invested in brain health, brain capital, and brain economy as much as we are invested in health of our patients with neurological disorders. So I'm here in my role as president of the American Academy of Neurology, or AAN, and I'm joined by our CEO, Mary Post, here in the audience. And on behalf of more than 40,000 neurologists and neuroscience professionals in more than 140 countries. The AAN is the largest world association of neurologists, and we are also the oldest in our 78th year organization that is based on individual membership. We are based on individual membership and based on the principles of inclusivity, so that we have members who range from medical students interested in neurology, like I once was, to professor emeriti, to private practitioners, anywhere from rural Texas to downtown academic hospitals in Boston. And as neurologists, we understand acutely both the importance of the brain, of course, this magnificent organ, the command and control center of everything that makes us human, but also the significance of conversation about brain and neurological health, because it's the foundation of that brain economy that you've been talking about all morning. And so, as a neurologist, a professional that is literally licensed in taking care of the brain, I just wanted to put brain into brain economy and brain health for all of you today as we talk about it for the rest of the conversation. Let's start by imagining what a shared collective vision of our optimal brain health may look like. Hope, joy, comfort, success, possibilities. But the reality is that over 1 in 3 individuals worldwide are living with a neurological disease. And this statistic doesn't even spare the youngest, both pristine but also vulnerable brains. And I was really heartened to hear some of the comments in the audience acknowledging the fact that brain health begins way before we start catching the signs of something that needs to be taken care of. And I'm so grateful to our colleagues from the IHME and beyond for bringing these data for you to be aware of with regard to the burden of neurological disease, but also for the fact that we understand that there are more to brain health than just a couple of conditions, and dementia and stroke are very important and frequently a focus of public and professional engagement. But neurologists know that there's more than 270 neurologic disorders that we take care of in our clinics across the lifespan. And those disorders, by the way, include neuromuscular disorders, because there is no brain health without neuromuscular health. Everything is connected in our system. You've all heard about the connectome, right? So everything is connected, and everything needs to be shone light on, including rare disorders, because we're not leaving anyone behind, right? No one left behind. Brain health for all. But it's important to talk about dementia, and many of you are familiar with this graphic, and some of the numbers already been brought in the conversations earlier, that about 45% or so of dementia cases seem to be preventable. And it's a great concept to actually follow and build upon to empower our patients and encourage them to take control of their individual health, and also to promote the concept of preventive neurology, which the AAN has been championing for a number of years now. But we, as professionals and those who are informed, we know that neurological health and prevention is way more complex. It's multi-layered, it's multifaceted, and all of those facets are interconnected, and it'll take this proverbial village, which we are representing today, individuals, communities, organizations, governments, societies, all of us, to work in the interest of prevention and health, and all of us to make this effort successful. And this brings me to brain health. So brain health, like many of you already mentioned, some of the other concepts that have been percolating for decades, brain health is not a new concept. Some of the new and some of the earliest publications are dating back to 1993 in PubMed, by the way. You should look it up, and just to see kind of the trajectory of how the concept taken on global recognition and exploded even through academic publications. But it's also been promoted by such giants and neurologists like Dr. Vladimir Hachinsky from Canada. And it took on, and now everybody seems to have a voice in brain health. But actually, when I think about it, who are the folks who are waking up every morning and going to bed for it every day? Who are in the face-to-face encounters in the offices with those patients who, who are coming with all sorts of neurological disorders. And I am proud to say that it's our tribe, the neurologists. And despite the shortages of neurology workforce around the globe, I'm proud to say that we have a whole army of neurologists in the US and globally doing this work every day. And here, they're doing the work during our AAN advocacy event, which we refer to as Neurology on the Hill, when hundreds of neurologists show up and will knock on any and every door of any and every congressman or woman and talk about the fact that we are not red and we are not blue. We're neurology green. That's a reference to our color, brand color. And we will fight and stand up for our patients and the public for the future of neuroscience research, and for the future of brain health, and for the future of the neurology profession. Because we know what's at stake, and we know what the cost of inaction is. And we also comforted by the fact that the American Academy of Neurology has all the competencies and also a long-term commitment to brain health for decades. Maybe some of you have heard about our famous bike helmets giveaway. We talked about TBI prevention. TBI prevention begins in the communities with the little kids wearing bike helmets so that we prevent those injuries. Our early history of the AAN Brain Health Fairs, a full-day event which was associated with the AAN annual meeting. Whatever city we went into, we opened the door to the public and actually bussed school kids from those, from those cities into these big hallways where we showed them slices of real brains, and we talked about prevention, and we taught them about EEG and all sorts of other, fancy machines. And, both school children and their grandparents had something to learn from a bunch of enthusiastic neurologists. And of course, for many of you who are familiar with public education, our award-winning Brain and Life magazine and also podcast that had reached millions in the US and worldwide. But the AN has not stopped at this, and out of the throes of pandemic in 2022, the AN has launched its Brain Health Initiative, which frankly transformed the organization as it is, with our mission expanding to promote brain health for all, but also it transformed really the whole field of brain health, kind of reset button, because now neurologists had the plan, and that was important. We have started by identifying our brain health initiative pillars. The AN always leads with science, so science it is, and then building on our competencies in patient care and public education and public policy. And by the way, I don't expect you to read any of this on the screen. It's actually in your materials. You could read the QR code that Pavel kindly provided, so you could look at that and all the materials. And we published our position statement and brain health platform in Neurology Journal in 2023 under the title of Brain Health Imperative in the 21st century, a call to action. For those of you who are interested in structured approach to what can be done across the field of neurology in a multi-collaborative way, I really encourage you to take a look at that. It's open access and freely available. Some of you brought up this morning the concept of definition of brain health, and there have been, God knows, there have been many across the years, and with every angle that the brain health conversation came about came a different definition. But the neurologists firmly believe that there has to be neurological health built into brain health. And so we gathered the experts across the lifespan and different lifespan brain health life stages. And we approached it in a scientific way through a modified Delphi methodology and came up with a definition of brain health as a continuous state of attaining and maintaining the optimal neurologic function that best supports one's physical, mental, and social well-being through every stage of life. And we encourage inclusion of all of those elements within a definition that we hope continues to grow and evolve as science grows and evolves in the area of brain health. We also introduced this concept of lifespan approach. Again, not a new concept of looking at brain health or other conditions across the lifespan, but we believe firmly that this is a continuum. Brain health is a continuum. It starts at the development of the brain. We are firmly committed to the kind of early stages of brain development from the fetal and childhood time to youth and adolescence. So then we don't have to play catch up in the later stages of maturity and senescence, but we can come up with actionable objectives for each of these phases as we move across the lifespan. We have published key priorities from neurologists and by neurologists looking at these epochs or life stages, and again, addressing the key areas of research, public policy, education, and communication. And finally, we've introduced a bold vision of brain health by 2050, where brain health research leads to accumulation of critical body of knowledge and scientific breakthroughs, where preventive neurology is thriving cross-disciplinary field that develops new leaders in brain health. We need an army of that. Evidence-based practice guidelines on brain health for all ages are available and continuously updated. A brain health visit, something that is a part of a well visit. We believe there has to be a well brain visit as a standard of care at every stage across lifespan. And we've been working already on developing the foundations for this visit prior to engaging with our different payer companies that we hope to, in the years to come to roll out. Education on brain health across lifespan has to be widely available and result in highly aware and engaged public. This is another point I wanted to highlight in light of the conversation that happened here in the morning. The doctors with the patients in their office, that's where a connection happens. You want public to be engaged. So it's not a top-down, it's a grassroots. So you want engaged public, we start engaging public from the beginning and get the doctors who are working with those patients, on board, and that's going to happen. And hopefully there will be a national brain health plan, kind of like NAPA, to guide scientific research care and public engagement priorities in brain health. We firmly believe that to advance this vision by 2050, we need to work together. I was so pleased to hear so many of you saying this over and over again from the time we started this conversation. So to advance the future of optimal brain health for all, we need to collaborate, innovate, and synergize. As a first step, and something that became an annual tradition for us now, we launched our AAN's Brain Health Summit in 2022 in Washington, D.C., and we just finished our fourth one. In my mind is probably the best one so far, was focused on empowering communities, and we really had a show of unity from the entire House of Medicine, with American Psychiatric Association, American Academy of Pediatrics, American Academy of Family Practitioners on the stage, kind of taking a public pledge on working together and getting brain health concept, across this swath of more than 300,000 professionals, practitioners in the United States who are practicing medicine. So this was a very momentous occasion. But overall, we had more than 100 organizations from government, represented there, including NIH, to our professional colleagues across professional organizations, grassroots associations, industry, very important. We have so many industry partners, and we really are grateful for some of you here in this room who were with us at the Brain Health Summit for the AAN, and of course, a number of academic institutions, private practices, and community centers for brain health, really covering the entire lifespan. So it's through these efforts that we've been able to do something that is difficult to do in Washington nowadays, but to get the consensus of the government to agree and support a bipartisan resolution declaring National Brain Health Day for the first time in 2022, coinciding with our inaugural Brain Health Summit. And we will do pretty much anything we need to do, and we will use all of our political capital working on the Hill, trying to get the Congress people and anyone off the Hill, because now through our political outreach for neurological support, or PONS network at the American Academy of Neurology, a new advocacy initiative, we're actually able to make real changes in healthcare policy in the states. And for some of you who know the politics in the United States, sometimes it's much easier to move the agenda forward at the state level rather than at the federal level. So we are in the states now, almost all 50 states, and we have, again, an army of volunteers who are working to defend neuroscience research, our patients' right to access to neurological care, and the future of the profession. At the same time, at the Academy, we've been working across different workflows with the Brain Health Committee leading the way on developing products and services for and by the trusted source that neurologists are. This is just an example of something that just came out this year, a prequel, as I call it, to an entire pipeline of evidence-based products that the Academy is planning. And this first one, Emerging Issues in Neurology, was focused on the neurologist's role in promotion of brain health. We've been able to pull together a group of experts that came up with this very clever acronym, Safest Brains, that reflects the 12 domains that neurologists can get engaged in promotion of brain health. Again, it's online, it's open access, so for all of you who want to learn more, you could look at that, or you could look through our Brain in Life products that we've been able to turn into a public-facing product and sort of kind of empower patients to start conversations with their neurologists about brain health. So for this and more, please visit our AAN Brain Health page. It seems that even though we've been working now for a few years, it just still seems that we're at the beginning of the journey where we're all going together. And there are a couple of messages that I wanted to convey. One is that the future of brain health and preventive neurology is bright. I also want to ask you to continue to engage neurologists in these big efforts on brain economy, brain capital. You want to be in those rooms where patients and doctors are talking about their brain health, and that's one way to do so. So please continue to engage us. And I also think that it's not a secret that we are all in this together. And together we must work to organize kind of the space in which we communicate, built on science and expertise. And I want to repeat that again. We have to communicate from the space of science and expertise as not to shake already fragile foundation of trust that our patients and the public have of health-related spaces. And the other aspect of that is that we need to work together, and we together need to speak in one voice about brain health. Because if we don't, we're risking creating a lot of noise. But when we speak together, we actually amplify our impact infinitely. And that hopefully will bring the day that I always dream about, and I use this as my personal source of inspiration as a neurologist, as a doctor, It's the day when every child born into this world has an opportunity of a lifetime for brain health, because that means that there's going to be a really promise of brain health for all. Thank you for your attention.